I think we are live. Good evening to all the students who have joined in. Uh, Hello, everyone. I'm Dr. Sandeep Sharma. I'm the pediatric faculty at DocTutorials, and I'm joined by the eminent radiologist, your favorite radiology faculty, Dr. Khalil sir. So, welcome, sir, to this live session.
Good evening, sir, and good evening to everybody and all the FMG aspirants who have cleared this exam. Heartiest congratulations once again. Yes, sir.
Sir, basically, we have joined here based upon student demands because we know that a lot of our friends have cracked the FMG exam, but now, just like a tiger has tasted blood, so now they want to continue this momentum and start preparing for the NEET PG entrance also because that is the bigger battle. But
Yes.
once someone has cracked FMG, there is always that uncertainty. There is always that tendency, the human tendency to go slow. So we are here as the mentors at DocTutorials to help you to help these students and find out, help them in guidance, help them in knowing the correct way to prepare, so that after this FMG success, they are able to crack the PG entrance also. The NEET PG exam as well as INICET exam is in the first attempt. So, sir, your initial views before we start with the session, sir.
Yes, sir. Sir, as we all know, the kind of results that FMG students have got in this exam, and there's a huge change in the kind of subject that they are acquiring and the kind of knowledge that they are gaining for these exams. And we saw so many students getting very high scores, and many of them actually clearing in the first attempt. And so there has been a trend change in the results because of the FMG students now coming back are mainly the NEET UG qualified students who marginally missed the seats in India. So the kind of quality of students are on par with the Indian graduates here. And once they have cleared the exam, you are going to see a tough competition with the NEET PG and INICET exams with these students. And many students have got more than 200 also. And, the kind of information that these guys are prepared with, I think a lot of their preparation is already done based on the MCQ preparation. So I'm really hopeful. And this is a lot of effort that is done to gain this knowledge, and if they continue this momentum, I'm sure they can make it to a very good postgraduate seat also. That is the main goal for most of these students. When they started, it was not just about clearing this FMG exam. They always started of becoming a good doctor, and the journey should continue till that direction, both for the student and for the family also.
Very rightly said by sir. The journey should continue. You have started. It is not the end. It is the beginning of a beautiful journey. And I'm also joined by Dr. Pallavi ma'am. Pallavi
Hello,
ma'am is the
sir.
dermatology faculty at DocTutorials. Ma'am, there are students who have cracked the FMG. They now want to prepare for NEET PG exam. Your initial views, why an FMG student should not rest before they crack PG entrance?
Sir, as I always tell the students, the FMG exam is just a step in their journey. It is not the destination. So your journey is a little longer than the FMG exam. This was one step. Now you move to the next step of actually achieving your dream of being the doctor that you wanted to become. So having a specialization, clearing the NEET PG exam, doing the degree, which the vision which made you go into MBBS. So, in order to achieve that vision, another step in your journey is the NEET PG exam. And yes, you should not be resting till you give that also a good attempt and keep doing it till you succeed. You have to keep working hard. See this as another exam that you give, see this as another step in your path. Don't see it as a problem, see it as a solution to your dream, achieving your dream. That's
Very
what I
rightly
would
said,
like to say.
very rightly said, ma'am. So, what we'll be doing in this session is, first of all, I've made a few slides. In these slides, there are only questions. So, these are the questions which all of you, the students, have asked us. So, I will be sharing these questions with the elite panel that we have, sir and ma'am, and I'll be taking their views on that, and then we will be making it a open house, and in case you have any doubts, you are most welcome to ask about it, about the study plan, about the sources to use, all those things also, even the controversial things we'll be taking up in this session. So I just want permission to share my screen. So if you can see the screen right now, uh, first of all, congratulations to all the FMG cleared students. I hope the screen is visible. What's next? The next step is the journey towards cracking NEET PG 26. Why am I saying 26? Because 25 already, most of you will not be eligible. So 26 is the time you are going to be eligible. Many of you are going to be eligible. And how different? So the first question I want to pose to both sir and ma'am: how different is NEET PG preparation from FMG preparation? Khalil sir, I have got a lot of messages from students. Many of them, most of them, in fact, are I students who have done great wonders in the exam, and they are saying, "Sir, my FMG exam went well. I am very confident of my notes. Should I continue reading the same notes? And is my current resource going to be enough, or should I need to do something different?" Over to you, sir.
Yes, sir. Sir, the NEET PG preparation, FMG preparation are similar in many aspects and also slightly different. It's similar because the subjects remain the same, the concepts remain the same. You have done a lot of background work, you have done the MCQs, and during your FMG preparation, you already do your NEET PG PYQs and stuff. And you must have realized that when doing those NEET PG PYQs, the concepts, the topics were the same. But the also you need to understand that you have covered 70% what would be required for NEET PG preparation. I want all the students to have that mindset that yes, 70% of the preparation is done if I really hold on and stick to the intensity throughout this preparation, the internship phase, and also till you attempt your NEET PG. You have high chances and high probability of getting into NEET PG. You, as we all know, that All India rank 10 this year was an FMG student. So it is not that you're doing some different kind of preparation, but yes, the amount of knowledge that you have to gain is going to be slightly higher now, because it's not just about qualifying, it's about being competing. So it is not about being happy about 150 160s 165s and stuff. Now you need to know not to do mistakes, not to do negative markings. And so that is where a lot of pattern has to be understood about the negative marking, how the GTs would be different from what you have been practicing in FMG. Your accuracy has to be much more, your subject depth also has to be slightly higher. But still 70% you have already done. But being a competitive exam, for that 30%, if you maintain the intensity and go without loosening your grip on the subject, I'm sure that all of you would come out successful in this exam also. So you started with the same mindset. You started that whatever is required we'll do to clearing FMG. That intensity was most important. And if you can maintain the same intensity and same determination that yes, I will crack this NEET PG no matter what, and that is where the game changes. What I see many FMG students while preparing, they have a very, very strong intensity, a strong determination to get this done. But once they come into the internship phase and they are relaxed after a very intense exam, they get into a relaxed mode. And when they lose the time of preparation, they have to restart it with a lot of effort. If they maintain the same momentum now, I think that should be a good exam and easy exam to be able to crack into if they continue the same intensity.
Sir has rightly said. To summarize, what Sir has said is the topics remain the same, the way of preparation remains the same, but how it becomes different is there is negative marking that makes all the difference. Second, the depth of topic you need will be more. Thirdly, your chance of making mistakes will now be minimized because now it is not a licensing exam; it is a exam where you have to do better than others. So there is very little scope of doing silly mistakes or just taking that risk in the exam. Now you have to know precisely. So in that respect, the exam becomes a bit more on the tougher side. Palvi ma'am, anything to add, ma'am? How's your view? How is the NEET PG
So
preparation different from FMG?
the points put up across by sir and summarized by you, those are extremely important to understand. You have to understand that in this exam, we tell you that you have to mark all the questions. Your major aim in this exam is to cross the 150 mark, and wherever you are between 150 to 300, all of you are the same. In NEET PG exam, every question, every correct answer, every negative point that you get can change your rank. It can change the seat you get, change the college you get. So the intensity of preparation for this exam is different. This is a competitive exam. You have to compete amongst your friends, amongst your colleagues, to get a rank, to get the seat that you want. So the intensity and the grilling that is required here is different. You need more confidence, because the confidence in marking the questions correctly, avoiding negative marking, yeah, these are all very subtle but very important changes that you have to make. And Another reason why you should not be resting, as has been rightly put by Dr. Khalil also, is that the intensity, the momentum, the foundation that you have already made, you have already built your concepts, you have made your foundation. Now you have to solidify it, strengthen it. So one more question you had asked in the beginning, what resources to use and all. I would say you have the basics and the foundations, your resources, your notes already with you. Go through NEET PG regular classes now. Go through the test and discussions. Whatever extra points you pick up, those you add to your existing resources so that you don't have two entirely different things to read. So, what you have already read, build on that, add extra points to it, build your foundation, strengthen it, and keep reading it till that would be the only difference in the preparation between these two exams, additionally to what sir has mentioned. So
Thank you so
don't
much.
change your resources altogether unless you are extremely dissatisfied with what you have. Yes.
Momentum is one thing which both Khalil sir and Palvi ma'am have pointed out. The meaning of momentum is, like, I'll just give a stupid example. It's not a stupid example, but all of you who are cricket lovers would know that a player is going with flow and suddenly there is a rain and there is a drinks break. People come back and then the wicket is lost. So what happens there? There is a gap. There is a fall in the concentration level which happens when you have cracked the exam and you continue reading a bit after maybe taking a break for a couple of weeks or so, celebrating the success. If you continue this preparation, even if you are very slow, you will not be out of touch with your resource material. And with every drop that is getting added to your, every drop of knowledge getting added to your memory, everything is going to matter when the final battle of NEET PG comes. So momentum is very important. Don't get too relaxed right now. Even if it is 15 minutes a day, do read something which is taking you closer to your exam. Now, moving over to another contentious thing, like it's not a single question, multiple questions are there. How to start, when to start, and what resource material should I be starting with? Over to you, Khalil sir.
When to start, I would say, if you have taken a break, enjoyed your fam with your family, celebrated with your family, I think it is time to look for bigger wins. And the sooner you start, because it's a competitive exam, the more knowledge you have, the more exams that you have written, the more MCQs that you've gone through, the more better your chances would be. So after you're done with your celebrations, I think this is enough time now. The results have come down, and still, if you are in that celebration mood, finish off when you have come through a very good phase. But once you are done with that, maybe a week from now, or as soon as your celebrations are fine, and once you come back to this zone where you want to go look at the next phase of your life, this is the time to start. And too late would be to again bad. I've seen students struggling to understand their own handwritten notes that they had with them, their own hands. Once they start with the internship, get into that hustle of the internship, and then come back to starting the material preparation, they find that when did we study this? Are these my own notes? Is just because of the long gap that they give between the subjects, and that is natural to happen. Even if you have taken a break for 1 month, the same break would happen. So the sooner you start, it's a competitive exam, it's an exam, but it's a high stakes exam. People all over the country are studying, right, with a lot of intensity. People are preparing from their final years. So the sooner you start, the better your preparation and better your chances would be. When to start, how to start. Now, how to start, I would say, this exam, especially in NEET PG, focuses heavily on your clinical subjects. So if you have having a clinical subjects weakness, like surgery, medicine, or you have not done any major subject properly in your FMG preparation, I think you should consolidate it. And that is, you have to individually look into which subjects are your weaker areas. If you're preparing for INICET, usually the preclinicals and the paraclinicals are heavily tested, and much more depth they are tested in. But for NEET PG, the trend is usually towards the clinical subjects, the third year and final year subjects. See that you are strong in all those aspects. And what to start with, I think there is a lot of content available today, and the commitment to complete is the clue that is going to be there. And that commitment comes from a disciplined, structured approach. So, and if I look at the retention also, I feel online live has much more retention over pre-recorded. And obviously, this will give you a discipline and a structure and the consistency that is needed to crack any exam. Yes, sir.
Absolutely, sir. So very valid and very useful points given by sir. So sir has given you a bird's eye view of start early. Number one, how to start. Pick up a resource and start with it. And if there is an option to do online live kind of thing, continue with it. So I'll be coming to that also. And what are the options available? We'll be discussing. Palvi ma'am, your views on how, when, and what to start with.
Sir, when to start would be now. The result has been there for almost 3 weeks now. So, to begin the preparation, it has to be now. Do not delay, because here, whatever days you lose, you are losing out on studying. Whatever days you start late, yes, your confidence reduces, because you feel, oh, I don't have enough time, maybe I'll not be able to finish my preparation by the time exam is here. So don't lose this initial momentum, don't lose these days initially. You build your confidence more when you start early. You have more grip over your schedule. Plus, be organized, be disciplined. As sir has mentioned, start with your weaker subjects. When you're preparing for FMG, a lot comes onto you suddenly. There are some subjects you don't do that much, some subjects you don't understand, you tend to leave them, because here in the FMG exam you have the scope of not knowing some part of subjects, not knowing a few subjects also. You have that scope. Here you don't have that scope. So start with your weaker subjects. They will take time. You have time because you are starting early. And as your confidence builds, keep giving a few, keep revising your weaker subjects, start with your stronger subjects. Do have a mix and match approach, but have a schedule, have it organized. Do not take it easy. You are now not just giving an FMG exam with your friends, you are actually giving it an all India level, competing with students from across the country. So that sense of competition has to come, because when that sense of competition comes, then you give it that extra edge which you require. What to start with? You, as I said before also, you have your resources. Try to read them, see what your weaker points are. Join a session where you are either having online live classes or even offline classes, but join a coaching, join a platform, so that you have a schedule to work along with. Your schedule remains consistent and you are motivated. Just don't think that you can do it on your own. You need that push, and that push will come when you have joined an online live session. You have to just keep building up. So my battery is running low, I just have to put the charger. I'll just come.
No issues, ma'am. No issues. So, to add to whatever ma'am and sir have said, uh, first of all, whenever both sir and ma'am have said is that you should be starting early, and by starting early, we also mean is that many of the states, the internship starting time is going to be a bit delayed. So the next 3 or 4 months that you have, this is the golden period. Just like in neonatal resuscitation, you have golden 1 minute. Similarly, this is the golden next 3 to 4 months that you have. If you can try to finish off at least one or two preclinical, one or two paraclinical, and maybe one, not medicine surgery, but maybe a slightly smaller subject compared to medicine and surgery, one or two clinical subject, or maybe one short subject, it would do great to your preparation. Because once internship starts, you will have a hectic posting coming, you will have a lighter posting you can always catch up. Hectic posting, it will be tough for you to read. But even in a hectic posting, say you are posted in Ops Gynae for 1 month, try to finish off Ops Gynae at least 70 to 80% during that period alone. Because when you are on duty and you are seeing deliveries happen, maybe you are assisting a delivery, and then you read the stages of labor, and then a CTG machine is there, and you look at the partogram and CTG waveform. What you are reading, what MCQ you are solving, you are also doing it in the duty. You will never forget. So be smart and try to plan your preparation accordingly. My suggestion is that majority of the bigger subjects should be done along with the internship, and they are doable. Don't think that somebody is going to give you time. There are people who during internship prepare well and they crack in the very first attempt, both IMGs and FMGs in the NEET PG exam. So it is doable. So the time is limited for everyone. You have to create that time for you, and the next 2 to 3 months is going to be very important. How to start? Again, as I said, start early. You can. There are two ways to prepare. One way is that you catch hold of your existing FMG notes and then start adding points to it. Because let us be honest, your FMG material is not going to go waste, but it is not going to be sufficient by itself. I'll give an example. If you have attended my classes, febrile seizure, I teach about 8 or 9 points. It's a half a page thing. If you go into NEET PG or INICET reading only 8 points of febrile seizure, you will lose the plot. In the previous and the preceding INICET exam, you had two questions each asked from febrile seizure, and those are difficult things, and every question matters. So now it is time for you to increase the depth of your preparation. If you think you're going to prepare sitting at home, not going to happen, unfortunately, because everyone is preparing. You need some help, you need some hand holding, you need some coaching. Types of coachings available: one, recorded lectures, good to have, but let us be honest, lack of motivation will eventually kick in. If you can stay motivated and you have that fire in you that you can get up early in the morning, finish those videos, go to duty, and then come back and finish those modules again in the evening before you sleep, go for it. Apart, if you can't do that, and if you feel you are like just me or any other average normal Indian student, we are all lethargic, and so you need a plan. And this is where those live online classes come into play. Many institutes do offer them. DocTutorials also offers that. So online live, you have set schedule given to you. You have workbooks given to you. Teacher will be coming, teaching you. Somehow you are on duty, you cannot attend that. You can come back in the evening and see the recorded lecture. And next day, when you are a day off, you can start from where you had left. So you have that sense of completion also coming in. Plus you will have access to all the recorded lectures also if you want to see something. So something like this has to be inculcated. Offline 1 year coaching not going to be possible along with internship, so let us not keep it as an option at all, right? So what resource to use, we will come and we will share what options DocTutorials is offering to you. So understanding the NEET PG 26 challenge, there is increased competition, there is changing question pattern, time management and stress handling, importance of structure preparation, and yes, negative marking makes all the difference. Plus, why do you choose DocTutorials NEET PG? We have an online live power pack. It is curated by top medical faculty in the country. Uh, we are here, myself, Khalil sir, Pallavi ma'am, we have Rajiv Dhawan sir, we have Vandana Puri ma'am, Rahul Rajiv sir, we have Raja Mahindran sir, all the doyens, all the experts in the field of PG coaching, some of the finest brains in the country, people with more than 20 years of experience, people who have seen people go all the way from a kid to a super specialist. All those people are there to guide you in, and hand holding is there at DocTutorials. We are have an integrated learning model. We have live lectures, we have recorded lectures, and we have practice QBank as well as PYQs available to you. There is focus on high yield topics. We have a lot of programs. There is a detailed program. In the same program, you have an option to read details, you have an option to read live, you have option to read synopsis, you have option to read quick revision, and you have option to read what you call as HIT, highly intensive training, where only high yielding topics will be discussing. And we are not just going to go away like this. We'll be connecting with you, we'll be staying connected with you, and there will be real-time doubt clearance for all those students who are now serious and have not joined somewhere. And even if you have joined somewhere and it is a recorded lecture, batches are starting in February 25 and March 25. You can definitely consider that. Before I go to the next thing, Pallavi ma'am, I hope your battery is now
Yes,
better.
yes, yes, yes.
So ma'am, I'll start with you. There is a tendency in FMG, people pay a lot of attention to medicine, surgery, gynae, and then anatomy, physio, biochem, and generally the shorter subjects. Radiology they all read, but dermatology, psychiatry, anesthesia, there is a tendency to leave them. How this approach now needs to change? Over to you, ma'am.
Sir, that is what I have said, and I will repeat that in the FMG exam, you tend to leave the subjects you don't like, they are weaker, you tend to do the PYQs because there maybe one odd mark wrong may not make the difference. But in the NEET PG exam, every subject every question makes a difference to the result. So all these shorter subjects are extremely high yield subjects. They are those kind of subjects which you spend hardly 5 to 7 days studying, and they give you at least 7 to 9 questions in the exam, which is a lot. So, with all these shorter subjects, you can do them in lesser time, maybe finish them all within 1 month, and you get 30 to 40 correct answers in your exam. Another reason why FMG students tend to not relate with these subjects is because the other subjects you might still have some clinical exposure, the core clinicals. These you have never seen a patient, never gone to an OPD where these patients are catered. Here, while you're doing your internship, you will see patients, you will see x-rays, you'll see MRIs, you'll see psychiatry patients, derma patients. In an OT, you'll see anesthesia being given. So, you can correlate with all these much better. And then as you are reading, you will grasp them better. They will stay in your mind, and you can cover these with those internship schedules that you have. So that is the reason why there is a slight disconnect with these subjects in your FMG preparation. And you also tend to let them be, okay, this is a 4 mark subject, this is a 5 mark subject. There you grade the subject as per the marks. Here in the NEET PG, you cannot do that. Every question is important. And in dermatology, I can per se tell you, over the last 5 NEET PG exams, there has never been a question which has not been taught in the notes. So all these shorter subjects, there are no new guidelines, no new drugs, nothing new which is coming. Whatever you read in the workbooks, whatever is taught in the classes, you revise, questions are going to come from there. So you have a shorter thing to read, smaller amount of subject to retain in your mind, and yet you get more correct answers, you get more marks from these shorter subjects. So these should not be, I wouldn't say ignore, like these should not be taken lightly, is what I will say. Keep your focus on these shorter subjects as much as you are giving to your core clinicals.
Thank you so much, ma'am, for the insight on the shorter subjects and how to approach them. Khalil, sir, a student also messaged me yesterday also, and today also I got a message before the session asking to take this up. Sir, you are the best person on this. The query is, sir, everyone is talking about integration. Sir, how to integrate? Because sir, radiology is the most integrated subject. So if I am a NEET PG student, what should be my approach, and what do people mean by integration per se, sir?
Yes, sir. Sir, as far as the subject is concerned, it is important to know each subject in detail. The integration will happen once you understand the subject. You cannot directly integrate. If compared to radiology, if you don't do radiology intricacies properly, and you don't know what is T1, T2, and directly there is a question saying of a OBGYN question or a ovarian mass directly telling T1 hyperintense cyst, unless you understand what is T1, what is hyperintense mean, what are the structures that appear hyperintense. So the first thing before jumping to integration, I would say first do your subjects well. Look at, learn by the subject expert, go get into the details of the subject, get the whole idea about the subject. And then once the, in doctorals also, we are doing the high impact training, okay, the high intensity training towards the end of the preparation. And this is very structured in a blockwise manner, that we start physio, the patho, the medicine, the pharma, the same thing with surgical subjects, and at the ortho, the surgical comes. So the integration will develop once you come to that flow of subjects. And yes, one thing that can be done is when you're solving your questions, you can do these models together, these modules of these subjects together. You can club all these subjects of medical subjects at one time, surgical subjects at one time, but do not try to integrate without going into the depth of individual subject. It is easy on a later point of time, but you cannot go and do the subject thoroughly, and directly jumping into integration may not be an ideal approach. And as far as the learning is concerned, sir, that is one point that I would like to stress is, if I look at us as myself as a student, and I'm having 100-hour videos to watch for a particular subject, and I am having option to have somebody who can help me finish that workbook within a 4-day time, maybe 40 hours duration, and that is helping me to concise the concepts in much better way. and I can always go back and complete the videos whenever in my postings are there. And in during internship is actually better because you have 2 months of medicine, 2 months of surgery, 2 months of OBG. You are attending 5 to 6 days of live classes. You are getting the crux of the subject. You will understand your material better. You will understand your pre-recorded lectures better. You'll be able to complete them faster. You can do more questions now. But if I keep the burden of finishing 100 hours of questions of videos myself, and I'm struggling to juggle with them, and the retention is less, the clarity is less, and I don't have a discipline or a structure to complete it, there's no schedule that I am following, that creates the haphazardness in the preparation. So as a student also, if I think that if I'm having 150 hours of videos, I'm having 6 days of classes to attend for that subject, that will give me the sense of completion, and these are being taught by one of the finest team in the country, that subject feels much comfortable. Even my pre-recorded lectures become easier, my GTs becoming better, my subject wise tests become better. So I personally feel it doesn't take much time to understand whether it is working or not. Immediately once they attend even a single live class, this is the sense of completion of that subject that comes in will definitely drive them to complete a lot of things. And nobody's taking away the self study in this process. It only assists them to have much more learning time and learning period. And I think this would be a very very nice approach to continue with the discipline, continue with the consistency, and crack the PG preparation in the first time. So being consistent is important. Retention is higher in a live class when you're engaging with the faculty. When the faculty repeats, you see people doing some mistakes, faculty correcting them, or you answering it correct, right? So that intensity in the classrooms, the offline classrooms, the online live sessions, all of these will give you much more retention compared to a pre-recorded lectures. And obviously the pre-recorded lectures are needed to back up your knowledge, to improve your enhance your learning. And during internship, if they can fine tune with their existing postings, like even Dharma has 2 weeks posting, if they listen to the classes and use it when they are actually in their dermatology postings, it will have a lot of value to their even internship preparation, even their internship learning also.
Very rightly said,
And
sir.
sir, one more point to add to the integration and the benefits of the classes, as sir mentioned, we as faculty, when you are in the session, we are teaching you, we tend to tell you the integrations, when we are teaching. So you don't have to worry about integration. What is integration? That is just two subjects combined and a question is asked. That's the basic, you're anyway studying it. All subjects are anyway integrated, so you don't have to specially focus on integration of subjects. That will come as you are studying. And as you are reading in a class, the faculty is teaching you, we tend to anyway tell you that this question comes as an integrated question. This is where you have to think of this. So that clinically integrated questions, the clinical scenarios of the questions are discussed better in the classes. You attend the classes, you get that feeling in the class itself. You do the questions on the app after that. Almost all the questions we have, you know, kept integrated on our own in the app. Every question is made by the faculty of that subject. It's a fully faculty curated QBank. So even if you're dreading a clinical scenario or an integrated question, you go to the app, you do the questions, you get a hang of it, how it is and how to approach those questions. Plus, you get to see that live in your internship as well, live in the classes as well. So everything is being done for you, the integration is being done for you. You just have to keep up with the schedule and be there and get the classes when they are happening.
Nothing to add from my end because sir and ma'am have very beautifully explained the point of integration and the query raised by the students. So yes, doc tutorials. I'm not saying that because we are a part of doc tutorials, but we truly believe in it. In doc tutorials, what we call it as a 360-degree learning experience. We have a comprehensive NEET PG preparation because see there is a proper way we have prepared the program, and it is a program which has been designed by the faculty. Like the management of DocTutorials takes the inputs of all 19 of us. Then we have taken the inputs of all the students who have performed well, people who have not done well, and people who are now in the throes of preparation. And based upon that, we have created a program which caters to everyone. There is a 360-degree. Why do we say 360-degree? Because you have workbook based live session, you have recorded lectures, and the live session also, if you miss a component of it due to some duty, you can come back to it and watch it. there are detailed video lectures, then there are test and discussion sessions, then there is a quick revision program, there is a high impact training live session, which is the last mile based thing. Only 25 pages of pediatrics summarizing the 100 pages that I have discussed in a 4 days class. Now you have, so it will make sense only if you have done the initial class. But suppose you have not done the previous class and you're running short on time, this high impact training program, that 20 to 25 pages is also going to give you a fighting chance. So we have created and curated that program. We have India's only faculty created QBank. We have a power pack access. Obviously, you will get access to the recorded lectures, and QBank and test series will be a part of it. So it's a 360-degree program. You join DocTutorials. You don't need to read any other resource. Just depend on us. But end of the day, we can only guide you. We are only the Gautam Gambhirs. You are the players. You are the Abhishek Sharmas, the futures of our country. And if you believe well, and if you are trained well, you can score that century just like Abhishek Sharma did. So another thing, before I go to the next component, I open it to both sir and ma'am. How is NEET PG different from INICET preparation? Is the preparation same or is the preparation different? So over to you, sir.
Yes, sir. Sir, I think the subjects have to be done in detail, all the 19 subjects, so that part is the same. But in INICET, the depth required is slightly on a higher level. Not just slightly, the kind of questions that are asked, the topics that are asked are very different that you have to focus on, especially the preclinical subjects. The kind of biochemistry that is asked in INICET, the physiology that is asked in INICET is different from what is asked in NEET PG. So especially for your preclinical and paraclinical and the kind of topics that are more pro towards INICET, I think the focus should be on that. And the depth, you have to be looking at not just the important NEET PG. I feel if you study the most important relevant topics, you still have high chances of clearing. But INICET, because it's a high stakes exam with lot of competition and a lot of good rankers that you're competing with, your depth of knowledge should be on par. You should see that you are trained with big lot number of questions. See that you are immersed in the depth of the subject, not miss out any single question. When you're doing your GTs, and what mistakes you're doing, please review them properly. I think more depth, and especially towards preclinical paraclinical, and having the insight over the topics that are relevant to INSET.
Correct, correct. Pallavi ma'am.
Sir, everything has been rightly said by sir. Just that in the INI set, it is the foundation, it is the basics, it is the concepts that they are testing. That is why the pre and the paraclinical are important, because they are the foundation of your medicine course. So they are testing whether you have gone into the depth of the subject. If you look at the questions, they look very basic. On the first look, they would look simple, but the options are very closely placed. You have to choose between the options. So you need the depth, you need the basic understanding of the subject to target INI set. For NEET PG, it's more of a broader basis of the subjects that they ask. The relevant topics, the important topics, simple clinical scenarios. But in INI set, that clinical scenario also, they will ask you the very depth. So you require a proper reading and understanding of the subject. Make your foundations, make your concepts. There are no one liners or rote learnings that you do for the INI set. Work on your basics.
Absolutely rightly said by ma'am. There are no shortcuts here. So to summarize, NEET PG, INICET. NEET PG, more number of seats. INICET, lesser number of seats. NEET PG, yes, there is a huge variety of colleges you get. INICET, central institutes. All the aims, PGI JIPMER and NIMHANS entrance exam, you can join there. NEET PG exam -1/4 negative marking, INICET -1/3 negative marking. So negative marking is more strict over there. You need more depth, more accuracy, as Khalil sir said. NEET PG is a horizontally spread exam. Everything comes from a particular system of a subject, but many times they don't go into unnecessary details. But in INICET, there will be a certain few topics in every system where they will ask the details. To give you a simple example, topic of febrile seizure. Question asked in FMG, which of the following is most common cause of seizure disorder excluding newborn period below 5 years of age? Answer was febrile seizure. Works in FMG, but will not work in NEET PG and INI, because NEET PG, the question will be Febrile seizure child comes to you. What is the first step in the management? The first answer step will be, if 5 minutes have crossed, you give benzodiazepine. INICET, the question changes. You try to give benzodiazepine, but the IV access is not available. All of the following is oblique R. Multiple correct options correct. Which of the following options will be suited? You have rectal diazepam, you have buccal midazolam, you have nasal midazolam, you have oral clobazam, and you have all of them are benzodiazepines. You mark it wrong, you get -1/3. So now you need to know precisely. So the same topic, the depth of is varying according to the exam. So if you are well prepared, you're having a day. INI is definitely doable. My suggestion: prepare according to INI set level. If your day, maybe you are in AIMS or PGI, you're having a bad day, NEET PG will always be there. So keep the standards high. And this is how Dr. Tourist is going to benefit. Apart from the 360-degree learning experience, we have the WhatsApp group, we have faculty support. We are, as soon as you join any of the programs, you'll be added to a group. It will be a closed WhatsApp group, and all of us are available. Obviously, we'll not pick up your random spam calls at night, but when you message us, we'll be trying to reply as soon as possible. Even the so-called stupid doubts, if you have, because no doubt is stupid, it makes you learn. So we'll be there to help you out, and there will be personalized strategy sessions. Some of them are there on the YouTube, but some of the closed groups, closed, personalized mentorship you'll be getting at DocTutorials. Some of you have asked me, sir, when is the course starting? So the course tentative schedule, the live classes are starting from February 25, and there is another session which is starting from March 25, and it is ending on September 25. So we are not only telling the starting date, we are telling the ending date also. So you have time for self-study and multiple revision. But TND will be starting from, for the same session, TMD will be starting from 25 December and ending in 26 January. And HIT, the last minute, last mile revision program, that 20 page, 15 page per subject kind of revision program to give you that finishing edge, starting from February 26, ending at March 26. What it means is, in one program, we first make you learn all the 19 subjects in a workbook oriented manner. Then we make you do the TND. Then we make you do the HIT, which is our component of the quick revision program. And in between, you want to do self-study, you have time for that. You get stuck at some place, we are there to help you out. And obviously, if the date for NEET PG 26 changes, there is preponement or postponement, the program, we are flexible in that. DocTutorials will be changing the program accordingly. And any further queries from your end, our expert panel will be more than happy to help you out. So any other doubts? Why Priyansh Jain sir is not? See, Dr. Soni, Dr. Priyansh is teaching biochemistry here. Dr. Priyansh was supposed to join here, but sir is a wonderful, wonderful faculty. And Dr. Priyansh is an expert in integration. So, sir, when he'll be teaching you biochemistry, he'll also be teaching you the clinical aspects of biochemistry. And our medicine faculty, Dr. Rahul Rajiv, will be complementing that. He'll not be telling you about the biochemistry part. He'll be starting from where Dr. Priyansh has left. So, even the faculty content is curated. I try not to go into hematology. I do teach hematology, but my focus is on the treatment part. So pathology, Vandana Puri ma'am will be teaching you about sickle cell anemia, and then I will tell you what are the clinical crises and why hydroxyurea is useful in those crises. So it's an integration we are doing at DocTutorials for you. So you need not worry much about it, but you need to first trust. And once you trust, then you give your best shot in preparation. Any further queries?
One student asking,
Yes,
sir, like, do they need to study Harrison's? What is your take on that, sir?
sir. Time to read Harrison is gone. It's gone, sir. For Indian medical graduates, if you are in final year, the time is gone. Generally, the time is starting from the second prof till the beginning of final year. If you have already entered into internship, whether you are a FMG student or IMG student, time to read Harrison is gone. Don't try to read Harrison uh, because Harrison is a textbook from where it's a very massive book, and it takes time to build the concepts, learn them, and then apply. So what we are giving you is uh, the content at DocTutorials we always create based upon the standard books. So the medicine content is based upon Harrison already. You need not read Harrison for that. The pediatrics content is based upon Nelson and Ghai. You need not read Nelson and Ghai for that, and so on. So basically, time to read Harrison is gone. Don't fall into that trap. You will end up in knots. You will not be able to finish the syllabus. Even medicine, you cannot finish Harrison in 1 year. And if you are able to do it, maybe you belong to that 210 IQ person. If you have that IQ, go for it. Otherwise, don't fall into that trap. Don't waste your time. I have read Harrison in my times, so I know how difficult it is to read Harrison. Do not read Harrison.
Sir,
Yes.
one
Any
more
other question?
point. So
Alvin,
one
yes.
more point I'd like to add here. I remember when I was a student at your place, you know, a senior of mine who was my mentor at that time told me the time to do extensive studying is the first four profs. The time when you're preparing for the entrance exam, whether it is your internship or your drop year, you have to do intensive studying. So this is not the time for extensive studying. That time was there, but now it has to be intensive. What you study, you have to study to the best of your ability, to the best that you can. But yes, intensive is now. Don't go to textbooks unless there is a specific doubt, a specific topic that you have to read. Yes, you can refer to the textbook, but don't go about reading all the books at this point. You don't have so much time. You have to stick to your schedule. You have to be disciplined and organized, and straying from it is going to put all your schedule in disarray. Ultimately you panic, you lose out on your confidence, and the whole game is lost from there. So stick to the plan, and that plan has to be made in the beginning.
Yes.
Very rightly said, ma'am. Khalil sir.
Yeah, one more query the students were asking is what is the change in the pattern compared to their FMG preparation and NEET PG? One thing I would say is FMG has been a 50 marks block. You cannot go back from one block to the other block. The same thing lies, but the number of questions in NEET PG is 40 questions per block, and you will have five such blocks to cover those 200 marks. In INICET, the time limit is slightly lesser. You will have to complete 50 questions within 45 minutes, and there are about four blocks that you have. And slightly the model changes every exam. You have to see, last time we had morning and evening shift. So if you're planning for NEET PG, you should be preparing for 40 questions blocks that you have a total of five blocks that you will be covering. So, and the time limit will be lesser compared to what you had for your FMG, and obviously the accuracy should be higher. So these are slight changes that you have to adapt to those exams. And I think it's pretty much should be the same. You cannot go back from one block to the other block. Is the same as what you had in your FMG. Yes, sir.
Sir. There is another query, sir. What are some common mistakes students make while preparing for NEET PG? Can we avoid them? Please suggest.
Yes.
So, sir and ma'am.
Yes, sir. Mistakes I would say is first is taking it easy and starting very late. Especially for the FMG students, they get so much into happiness. I know it's a very, very huge relief after passing this exam. Parents are happy, everything is good and happy at home, and they slightly lose out on their dreams. So that is what I have seen happening with most students who actually pass FMG. So I think it is important to be humble and keep working towards your goals, right? And delay the gratification to a later time, and let there be a bigger success. So one thing is that stay grounded, stay humble, and stick to your resources. Revise the materials that you have already done to get a baseline thing. Do not think that just by doing this material you will be able to crack the exam. Just revise them once. If you have done maybe you have done so many revisions of that same material now, just revise them quickly and see that you evolve with the exam pattern and the depth of knowledge that is needed. And do not waste your internship. You'll have multiple excuses to make, that the duties are hectic, I have to do night shifts and stuff. Yes, we all agree with that. And at the same time, this is a high stakes exam. You have to have the willingness to be ready to sacrifice, to take some effort. There is no gain, no pain, right? So you have to go through that. And as if you prioritize it, you will find time for it, right? And there are so many students, as sir also has mentioned, there's so many students who have cracked NEET PG in during the internship. And whatever time you're getting, make best utilization of that. And one thing I also see that students postpone their preparation, saying everything, let everything become very rosy. Let me finish off this internship period, let me learn the skills and all, I'll start NEET PG once I'm completely free from all of this. Your as Rajiv Dhawan sir says this repeatedly, your imperfect preparations will get you results. Whatever time you're getting, 2 hours you are able to give in a day, 3 hours you are able to give in a day. There is a version that you get your workbooks in your hand. The workbook gives you a direction. The hard copy workbook is so important, is that it gives you that pressure that I have to complete this workbook, and it is a doable thing. And you cover 2 hours now, next 2 hours next day, and when you're free you cover a larger concept of that, so that that drive will be there. So don't look for an ideal perfect time for preparation. Be willing to do those imperfect preparation, do some MCQs when you get free in your postings and stuff, and keep going, progressing through your internship period along with your NEET PG preparation. And a few more inputs, Pallavi ma'am or
Thank you, sir.
Sandeep sir.
Tell me, ma'am.
Sir, you have put across everything very nicely. Just do not delay. Have your short term targets, have your long term targets, have your schedules ready. Keep some extra time in between a few subjects to catch up your pendencies and keep studying. I would say no study goes waste. Okay, everything that you are reading, every hour that you are putting will be of use either in this exam or maybe in the next exam that you give. But no studies go waste. So do not put your studies for a later date, that I will start studying from this day. Okay, I'll start studying from the next month. No, whatever you manage in this month also will be helpful for you. So just value your time is precious, and that, if you realize, everything will fall into the place. This time is very precious. Think of it as your first and last attempt, and just think of the happiness you get when you get the result. No, you don't have to study again. So keep working for that happiness, and that will, get you through this year.
Rightly said, ma'am. Although super speciality is also looming in many of the branches, but yes, after cracking PG entrance, it's an option. It's a choice. Like right now, you don't have a choice, but then it becomes more of a choice. Now, mistakes to avoid. One more mistake. I'll give an example. When I'm not one of the things which I seldom get to do, but I like to cook sometimes. Whether you're cooking paneer or you're cooking mutton, if you undercook it, it is going to be raw. If you overcook it, it is going to be rubbery. So the meal is going to taste good only when it is properly cooked. There is a balance you need to get. Preparation is also like that. You are overdoing it. Some people are in the habit of overdoing it. Sir, I will buy three different platforms and do medicine from three different platforms. Good luck doing that. 8 months you will finish hardly medicine, and then you will be looking at a place where in 4 months you have your exam coming and you have 18 more subjects to do. So your 1 year is wasted. That is overdoing it. One is underdoing it. Sir, I will only go for a shortcut revision program. I will do two shortcut revision programs. Two shortcut revision programs will tell you only one liners. If you have not done a proper preparation and then moved to a short revision program, your preparation is again lacking. You will be sitting in the exam, but then your rank will be not giving you the seat of your choice. So don't undercook or overcook your meal, your meat, your paneer, and don't overcook and undercook your preparation. This is very, very important. You have limited time available. Time is, yes, a lot of time is available. Internship is yet to start for many of you, but plan properly. And if you can't do it yourself, ask mentors. Before I go to the next question, announcement tomorrow, same times, 8 p.m. We are going to come, and your favorite Rajiv Dhawan sir is also going to join us. We'll be talking about the preparation strategy, 100-day preparation plan, how to prepare for NEET PG and INICET in 100 days if you have only 100 days available, the smart strategy and some useful suggestions. So join us. I'll be there. Sir, I think if sir can join, sir can create time, it would be great. Palvi ma'am will be there, and your favorite Rajiv Dhawan sir will be joining. So don't miss the session tomorrow. It will be more like a continuation of what we have done today, and 8 p.m. tomorrow we'll be joining there. Apart from that, regarding the eligibility for NEET PG 26, it depends upon the day of starting your internship. So that will vary from state to state. So there is no hard and fast rule. The day you are starting and the day NEET PG 26 is being held, that will decide. So that is something which is not in your hands. Focus on starting early so that whatever first exam you're going to give, imagine you're not able to give NEET PG 26 due to some reason, but the first exam you sit is INICET and you crack it. You don't even need to give NEET PG at all. You want to give it, you give it, knowing that you have cracked INICET. I know many people who give it. I once was taking an interview as a topper. I asked him, why have you given NEET PG? And he was like, sir, maze ke liye. Right? He was not going to attend the counseling. You imagine you are in that scenario, and that is doable. 1 year plus time is available to you. The only question is, are you going to go about it? Number one. Number two, do you have a plan for it? Number three, do you have a proper resource for it? And number four, do you have that direction for it? So, if we can be of any help, you can reach out to any of us in the comments after this session goes up on the YouTube also in a recorded way. You can listen to it again. And we are all active on social media as well. You can always drop us a message and ask for our doubts. At DocTutorials, we always keep students interest first. So if you feel that we are already working with some plan and DocTutorials you're not considering right now, but will still need our help, we are still there to help you out. Right? End of the day, why we are saying DocTutorials programs, because we have created this program after a lot of brainstorming. Longer session, live session, recorded lecture, short program, ultra short program. QBank created by faculty, QBank test series, doubt solving session, personalized mentorship, all at one place. Why do you need to go elsewhere? That is the only thing. Sir, any other questions you want to take up?
Yes, sir. As you rightly mentioned, the team that is there is one of the eminent team in the country who has a lot of experience of training doctors. And I think, with the kind of people that have recently joined in also, we have Swati ma'am for anesthesia, Sonu sir has joined in, Priyansh sir is here. So the kind of impact the training is going to be is really, really amazing. I can assure you of that thing. And each faculty, right from your clinical subjects, preclinical, paraclinical subjects, there's an amazing learning experience that you're going to be there, and you don't need to worry about anything else. You leave everything else to the team. They will take care of your theory, they'll take care of your MCQ practice, the QBank is there, the GTs with video explanations is there, everything is there. Just stick to the process, trust the process, and complete it on time. Don't delay the whole process. And this crucial time before you start your internship is actually even more beneficial when you're completely free. Imagine that before your internship starts, if you're able to take care of nail in 7 to 8 subjects, that changes the way you would approach the exam. So I think if you can really plan well before your internship, maybe it may take 1 month to 2 months time for different states. This is a time when you're really free, and a lot can be done in this period. Okay, and then the batches are also starting soon. So I think if you are free and you don't have anything else to do, why not take more intensity and complete major subjects during this 2 3 months of free time, and enjoy your internship and keep learning accordingly. And as rightly said, the more better practice you have of your questions, the more better depth you have your knowledge, the better chances you have. And go with a determination that yes, we will do it. And I'm very, very hopeful. And honestly speaking, with the kind of results that have been coming in, the kind of students that we are training, I am really sure that this pattern is going to change in the NEET PG, and all that stigma that FMGs go through. I've seen many students actually being very positive during internship. I get the differentiation happening in the internship period itself, when they are with their other Indian doctors, and these people are also there. That when they are answering their queries and all, automatically the confidence and the difference, they're able to palpate it. And this is going to get better and better with the preparation coming in. So
Yes, DocTutorials videos are enough for INICET as well. When we teach a topic for NEET PG, we keep in mind that NEET PG and INICET, both of them we are preparing you for. So you need not worry about that, whether it is recorded session or live session. So in response to the question, yes, DocTutorials content will be enough for both. Now it all comes down to how good you are in retaining that content and how you are able to apply in the exam. And will there be live classes? Mohammed Shadab, yes, we have discussed the detailed program of the live classes. In a few couple of minutes, this session will end and it will go up on the YouTube channel. We have discussed the entire details, including starting and ending time. Everything has been discussed. So you can listen to the video, that part again. And if you have any doubts, you can ask again. Pallavi ma'am, should we focus more on theory than MCQs? What should be the proportion, or should we be doing in a balanced way? One student has asked.
See, there is nothing like focusing more on theory or focusing more on MCQs. The one doesn't go without the other, okay? So this has to be a balanced approach. You have to know your theory to be able to solve the MCQ. So you begin with attending a class, begin with going through a workbook, have your basics and concepts made in the class, read the workbook, revise it, whatever specific doubts you have, you can go back to your referring textbook and do it. You solve the MCQs alongside. So you don't do this that you've read the theory and then maybe it's a 5 day or a 7 day subject. 7 full days you read the theory and then 2 days you do the MCQs. It is not just about balancing MCQs and theory overall, it's also about balancing them in a day. So in a day also, there should be a specific hour devoted to doing MCQs. So, in that way, if you have your schedule set in a way that in the morning you wake up, you read the theory, you have a class, you attend the class, in the night you keep 2 hours for a MCQ practice. So this way you don't have to take out time for MCQs, you already have kept 2 hours every day for that, and you do them both together side by side. Your eyes see what your mind knows. So when you're doing an MCQ, if that is there in your mind, your eyes will solve the MCQ. So it has to go on together, it has to be divided, it has to be balanced, and you have to take out time for doing MCQs every day, I would say. Keep your schedule disciplined, that at least 100 questions a day you are solving. You may read theory for 8 hours. If you're not able to translate that theory into the correct answer in your exam, all that theory is, of no use. So practice your MCQs. The ultimate aim of whatever you are studying is to get the question right. So that will come with practice. As Sir loves cricket analogies, I also love this one, that howsoever good cricketer Virat Kohli is, Sachin Tendulkar is, they have to do warm up practices, they have to play league matches before they go to the final. So everything that you study is towards that final which you have to give. So keep practicing MCQs, keep dividing your time. Do not try to compete between them. There is no competition, there is no about what is more important. Everything is important here.
Thank you so much, ma'am. There is another question. Who will be taking anatomy? For anatomy at DocTutorials, we have Dr. Rajesh Kaushal sir. Rajesh Kaushal sir has more than 2 decades of experience in training students for PG entrance exam. To be honest, I have been sir's student. I still remember once upon a time I have attended sir's. At that time, institutes and these platforms were not there. So sir used to take his individual class at Delhi at auditorium. I at that time I had paid 5,000 rupees to attend that class, and so you can well remember that sir has been a legend in the field, and sir is there with DocTutorials, and sir will be teaching in a clinical integrated manner. I ran into sir just a few weeks back. He was doing recordings and he was discussing about how the way we are teaching median nerve and ulnar nerve injury needs to change because the questions which are being asked is also changing. So it's sir is an excellent addition to the team, and as Khalil sir also said, we have Swati ma'am in anesthesia, we have Sonu sir in microbiology, we have now Dr. Priyansh Jain in biochemistry. So the team which was good has become even better. So you're not going to have any regrets. Once you attend a session, you will understand the way we are teaching you, and all these doubts of how to complete a thing, how you are facing problems. That is what I said. We are there in this program itself to guide you if you have any falteration or any stumbling happening at any step. So we all 19 subject faculty experts are there to help you out. Khalil sir, is MDMS from domestic institution better or going for foreign medical PG? I sir, I don't think foreign medical PGs, most of them are valid in India.
Unless they're doing in US or UK, sir, I don't
Yes.
think they should plan anything in foreign and try to do that. It's a very specialized subject that you're going to get into. The kind of clinical experience that you're going to have will matter a lot throughout your practice. So I don't think you should do anything random. If you're getting into USMLE or PLAB, that is well and good. Otherwise, getting into a good training institute in India, that would give you a very good hands-on experience, especially for your clinical subjects.
And sir, also study during internship. Should we develop skills or focus more on preparation?
I think, sir, the if you know it, your skills will automatically improve. But both you have to balance both. I mean, if you're learning surgery and then you see what is happening in the department, you actually understand better. Otherwise, without knowing, if you're just roaming in the department, you will not know what exactly is happening. So I think the training program itself is good enough time to do, but don't do blindly. Just keep doing your routine clerical work there. I see doctors just doing, writing all the case sheets without having any understanding, without developing any skills. That would be a very wrong approach to your internship. As radiologist, I remember I did deliveries and only during my internship period. And if that skill is not there, now you will never feel that sense of completion of your clinical training and stuff. So I think you should not completely ignore it, but at the same time, both should be able to go hand in hand, and it is possible. And if you can really take in little extra effort, this is possible to match both. The clinical training duration for every subject is properly well divided, and you will get, if you understand the subject and then attend your 2 months of posting, you will actually enjoy it much better.
Correct, sir. Like you are posted in surgery, you enter into OT, see the zones of OT, see the sutures which are there, see the instruments which are there, attend your duty. As soon as the duty is over, come back, open the general surgery part and look at the zones of OT, the sterilization, the steps of hand washing, and then you will be doing it again. So now that you, and then second day, do you see it again and then solve the MCQs. So what is happening is you are not only learning during your duty period, but you are integrating it. As Palvi ma'am said, eye sees what the mind knows, and mind remembers better what the eyes see. So you are seeing it, you are implementing it, so it is going to be a positive cycle. So try to balance out both of them. It is doable, and you are smart people. We will not be telling you, you will learn it yourself. First few days you will have some problem. Once it starts, you will fall into that cycle. But beginning early is the most important thing. So I think we are reaching the end of the session. Palvi ma'am, any parting comments, anything to add, ma'am?
Keep confidence in yourself. You have come this far because you are smart, you are capable, and you are intelligent. And now you are just one more step away from achieving that dream. So keep your dream in sight, have a vision, study for that, make schedules, stick to your schedules. One odd day, 2 days, if you're not able to study for some reason, don't get panicked, don't worry. You will always have a little time in the end to cover up your pendencies. But try to stick to your schedule as much as you can. That's what. Just study. There is no shortcut to success here. You have to work hard, you have to study, and you have to study. That's what I would say. Just study. That's the only thing that is in your hand. Don't get worried about how the exam will be, if it will get delayed, if there will be any schedule changes, what kind of questions will come. You don't have to worry about all that. The only thing that is in your hand is your ability to study. So that is the only thing you can do and you should do. Take help where you need it, take direction where you need it, and take the help of all the faculties and the mentors that you have on the platform. Your direction, your motivation is the most important. It is ultimately you and only you who is going to do it for yourself.
Beautiful words, ma'am. Khalil sir, any parting comment? Also, sir, one line one student has messaged saying he has not done well in the FMG. He's attending this session, but any one motivation line for him as well, also, sir.
Yes, sir. And I think, sir, the question about internship, whether we should do more clinical skills and the, clinical theory part. The exam today is very much clinical. There are, the entire training itself is very clinical. So whatever classes that you're going to do is actually helping you to progress towards becoming a better doctor. And whatever clinical skills that you're learning in your internship is also in the same direction of progressing you to become a better doctor. So many catheters are being asked, and all of that is covered in the classes. So don't think that these are counterproductive. These are going to be complementary and assisting you. And I would say you have come so far. You have taken those steps, early steps. You have learned walking. Now you are in the medical field. The team, we had all handheld you to come so far to walk. Now is the time to run, and we'll be happy to see you, progressing and growing further in your lives. And this is the time where we would want you to shine and progress in life. And we are there throughout, and we'll be happy to see you progress. And even if you've got very less marks, I would say it doesn't matter. You have 1 month, one full year, and there's a huge thing. And already any FMG passed out student, you have done so many MCU. It's not an easy exam. It's a 30% pass percentage exam. So if you have passed this exam, you and that doesn't mean that you're not capable enough. And you are very good. I feel anybody who has passed FMG exam, they're already done 70% of the NEET PG preparation. I honestly believe that. So if you have got through this exam, have that belief and progress through that. And there are a lot of seats available. There are a lot of DNB seats that have merged into MDMS, and also there's always an available. Yes, sir.
With this, thank you so much, sir. Thank you so much, ma'am. We come to the end of this session. So, to summarize, we have shared for those people who have joined late. This session will go up on the YouTube channel. You can watch it again. We have covered a lot of ground and try to address every query possible. And yes, if you want to start early, start immediately, maybe start in the next 48 hours. If you are not sure about which program to join DocTutorials live program. There is no doubt about it. Details I have discussed in the program. If in case you are in doubt, if in case you have already joined some program, you can definitely consider DocTutorials one of the components to as a add-on in your preparation. But remember that teachers, mentors, and programs can only guide you. Eventually, it is your battle. It is up to you how well you fight it and with how much of focus and dedication you find it. Fight it well, and the result is going to be great. It is totally going to be worth it. Absolutely worth it, because that will give you your identity. After this exam, you will be known as dermatologist, radiologist. Right now, you're a doctor, but now you'll be known as pediatrician, orthopedician, surgeon, medicine person, microbiologist. So when you have an identity to get, why don't you give your best shot so that you have a rank and you get the seat of your choice, right? So with these parting
That
comments,
sounds so beautiful. That sounds so beautiful. That is the ultimate motivation to study and clear that exam to find your identity. Yes.
find your identity, and we are there to
Very
help you
nice.
out. So Khalil sir, Palvi ma'am, myself, all the team at DocTutorials is there. And a reminder, tomorrow we are coming again 8 p.m. We'll be talking about some plans, where you are standing and how you are going to implement those plans if you have difficulty in planning for PG and planning for INICET. So don't miss out the session tomorrow. Do join us tomorrow. So all the very best to everyone, and thank you sir, and thank you ma'am for sparing your time for this session.
Thank you so much,
Thank you,
sir.
sir. Thank you so
Bye bye
much.
everyone. Good night.
Bye.